Hi, my name is Kevin Moss. I'm a senior editor with Consumers Checkbook. We publish Checkbook's Guide to Health Plans, which helps federal employees and annuitants choose the right FEHB plan. Today, I want to provide you with an open season checklist. During open season, federal employees have an opportunity to review and adjust their health plan for next year. With more expensive premiums and potential benefit changes, it's important to evaluate whether your current plan still fits your needs. This checklist will help you navigate this process. Plus, I'll share tips on how to save on healthcare costs. Plans in the FEHB program change each year, so it's important to check what's new and what's being discontinued. There are two new FEHB plans, both in California, Sharp Health Plan in the San Diego area and Western Health Advantage around San Francisco. Additionally, Compass Rose lifted enrollment restrictions and has two plans that are available to all employees for the first time. The average enrollee share of premium is increasing 13.5% next year, one of the largest hikes in recent memory. But this doesn't tell the full story. Of the 144 FEHB plans that were available this year and next, 28 will see premium decreases, 5 will remain unchanged, and 111 will have a premium increase. To avoid any unwelcome surprises in January, review your premium during open season and compare how your current plan stacks up against others. You can find premiums on the carrier website and in marketing materials, on the OPM plan comparison tool, and on the last page of any FEHB plan brochure. The official plan brochure is a great resource to learn how your FEHB plan works. The one thing you should check every open season is Section 2, Changes for 2025. This is where the plan will tell you important changes like a cost share increase for a service, new pre-authorization requirements, or new benefits for the upcoming year. Here are a few examples of 2025 changes. All GEHA plans have added doula coverage, and Blue Cross Basic is increasing the member cost share for several benefits, including emergency care, urgent care, specialist visits, inpatient and outpatient hospital, brand name prescription drugs, and more. You always pay less by staying in-network, so check if your existing providers are covered by your plan. You can't assume everything will remain unchanged from one year to the next, so look over the provider directory on the plan website. Similarly, for any current medications you take, check to see if they'll be covered. Many FEHB plan websites will have prescription drug cost tools where you can select your drug, dosage, and preferred pharmacy to see its costs. Again, you can't assume there won't be any prescription drug changes in your current plan from one year to the next. For example, I've heard from some federal employees that have received a notice about a formulary change in the Blue Cross Basic plan that will significantly increase their out-of-pocket prescription drug costs for Wegovy, a GLP-1 weight loss medication. Due to a tier change, a 28-day supply at a CVS in the DC area will rise from $60 this year to over $700 next year. What you'll pay is more than just the plan premium. While important and a for sure expense, selecting an FEHB plan on premium alone ignores what you'll pay when using a healthcare service. In the most recent federal benefits survey administered by OPM, 81% of federal employees indicated total out-of-pocket costs as the most important factor when selecting a health plan. For 46 years, Checkbook's Guide to Health Plans has ranked plans on estimated total yearly costs based on user information, age, family size, and expected healthcare usage to help federal employees and annuitants see which plans offer the best value. The benchmark ranking shows big cost differences among plans. For instance, a family of 4 in the Washington, D.C. area with average healthcare and a primary policy holder age 50 could save over $5,000 in estimated yearly costs next year from switching from Blue Cross Standard to NALC Consumer Driven. With higher premiums on the horizon, federal employees should be looking for ways to save money on healthcare expenses. However, only about 20% use a flexible spending account, a for sure way to save about 30% on predictable healthcare expenses. From dental and vision care to prescription drug refills to over-the-counter pharmacy items, contribution and rollover limits are rising next year. Employees can contribute up to $3,300, but you must be somewhat careful in budgeting as only $660 of unused funds can be rolled over into a new plan year. Employees with an HSA aren't allowed to have a healthcare FSA, but they can still set up a limited expense FSA for dental and vision expenses, which is a good idea to help keep HSA funds invested. You must renew your enrollment every open season to keep your FSA. You can enroll and learn more at fsafeds.gov. FSA and FEHB open season ends December 9th. Thanks for watching. Please like and comment so more federal employees and annuitants can find this video, and make sure to subscribe to our channel to receive alerts on future videos.